Hi, I'm a physical therapist here at Loma Linda University Health, and I'm going to be reviewing your home exercise program. These exercises are designed to increase your strength and range of motion following your total joint replacement surgery. These exercises are meant to be done in a pain-free manner as much as possible. While you may experience some pain and discomfort during the exercises, we want you to try to work in a pain-free range as much as possible. If you do experience excessive pain or discomfort while doing these exercises, we recommend that you refer back to your surgeon to get some follow-up advice. So the first exercise that we like to start off with after your total joint surgery is called an ankle pump. We do this exercise to help increase your ankle mobility and to keep the blood flowing while you're not walking quite as much as you used to. This exercise consists of pointing your toes up towards your shin and then down towards the floor. We like to think about revving the engine of your car, pushing that gas pedal down and then relaxing. We like to recommend that you do this exercise about 20 times at a time throughout the day. At minimum, we recommend 3 to 5 times a day. So when you wake up in the morning, maybe during the middle of the day, and before you go to bed at night. This next exercise that we're going to do is called a quad set. For this exercise, we're looking to get a good muscle contraction in the muscles on the front of your thighs. It is common after surgery to have some soreness and irritation in those muscles, and so we want to reintroduce movement to them through nice, easy contractions. In order to do this exercise, we're going to have you squeeze the muscles on the front of your thigh, hold it for a second or two, and then relax. As you can see here, when he contracts his muscle, it firms up and his kneecap comes up towards his hip. This is what we're looking for a second or two, and then relax. Just like the other exercise, we recommend doing this one 20 times at a time, 3 to 5 times a day. This next exercise that we're going to do is called a heel slide. We do this exercise to reintroduce movement to both your hip and your knee following your surgery. This exercise consists of bending your knee nice and easily towards your chest to the point where you're starting to feel a bit of pain and discomfort, and then relaxing back all the way to the bed. You want to make sure you keep your heel on the bed during this exercise so that you get a good bend in your knee while you're doing it. For this exercise, we recommend that you do it 10 times and breaking it up into 2 chunks, and so you don't make it too sore. And then doing it 3 to 5 times throughout the day. It can be common to need some assistance for this exercise due to some pain and discomfort felt after your surgery. I like to recommend that you get your care coach involved to provide some of the assistance for you. Your care coach can assist by placing their hands underneath your heel and underneath your knee and provide light pressure to help lift your knee towards your chest and back down to the bed. If you feel any resistance to the motion, it's okay to stop and relax back down to the bed and just go nice and easy and not push into any pain or discomfort. We recommend that you do this exercise 10 reps at a time and in 2 set increments, and then do that 3 to 5 times per day. This next exercise that we're going to do is to help reintroduce movement to your hip joint after your surgery. It is important to do in order to help you with getting your leg in and out of bed after your surgery. For this exercise, you're going to be bringing your leg out to the side and then returning it back in front of you. You want to make sure you're not crossing your midline and just coming back to a comfortable position. Also remember to keep your knees straight as you're doing this exercise. We recommend that you do this exercise 20 reps at a time, 3 to 5 times per day. If this exercise is too challenging to do on your own, your care coach can assist you. To assist, your care coach can place their hand underneath your heel and your knee and take the weight of the leg off the bed and help move it side to side. As the patient, you want to make sure you are the one moving the leg side to side, and your care coach is just helping take the weight off the bed. We recommend that you do this exercise 20 reps at a time, 3 to 5 times per day. It can be helpful for your care coach to be positioned on the same side as the leg you are moving so that you do not have to reach across the bed to assist. But for demonstration purposes, I'm on this side. This next exercise we're going to be doing is called a straight leg raise. To do the exercise, I like to incorporate the quad set exercise that we learned earlier. To begin this exercise, perform a quad set like we did earlier by straightening your knee out all the way. Holding this, lift your leg off the bed to a comfortable position and then lower back to the bed. We recommend that you do 10 reps at a time, take a break, do another set of 10 reps, and repeat this 3 to 5 times per day. If possible, try to keep your leg straight in front of you and not let it waver out to the side or towards your midline. It is important to maintain a straight knee throughout the exercise by holding that quad set. If you reach a point where your knee starts to bend, try not to go past that point and lower back to the bed. As this exercise can be challenging, it can be helpful to have your care coach assist you. To assist, have your care coach place one hand underneath your heel, the other underneath your knee, and assist with lifting your leg off the bed to a comfortable position before lowering back to the bed. I like to recommend that you do this exercise 10 reps at a time, take a break, do another set of 10 reps, and then repeat that 3 to 5 times per day. This next exercise we're going to do is called a short arc quad. For this exercise, you're going to need a towel roll, a bolster, or a rolled up pillow will do, because we need to place it underneath the knee. This exercise will work on your quad strength and getting you to bend your knee a bit more after your surgery by kicking your foot off the bed and lowering it back down. Begin the exercise by placing the towel roll underneath the knee. Then lift your heel off the bed to straighten your knee and lower it back to the bed. You want to make sure your knee stays on the towel roll throughout the exercise and that your knee joint is the only one moving. We recommend that you do this exercise 20 reps at a time, 3 to 5 times per day. When you receive your front wheel walker, you're going to want to make sure that it fits you for your height. To find the proper height of your walker, imagine that you're putting your hands in your pockets and you raise the walker to that point. You want to have a nice bend in your elbows while you're using the walker so that you have some good leverage. If this is not a comfortable position for you, it is okay to adjust your walker one button up or one button down to fit your comfort. After your surgery, you will have some pain and discomfort in your leg. In order to walk, we recommend using the following gait pattern to do so safely. To begin, bring the walker forward, step forward with your surgical leg first, put your weight in your arms to support the leg before bringing your other leg to meet it. We will repeat this for each step. Bringing the walker forward, leading with your surgical leg first, and then using your arms to support the leg as you bring your other leg to meet it. Surgical leg first, pressure in the arms, non-surgical leg coming forward to meet it. If you need to go up and down the stairs following your total joint replacement, we recommend doing it in the following way. Going up the stairs, you will be leading with your non-surgical leg. You will be going one step at a time and bringing your surgical side to meet it. So lead with the non-surgical leg and bring your surgical leg to meet it, repeating this for each step that you're doing. If you have a handrail at home, we recommend that you use it as you go up and down the stairs to support your leg. It is nice to have your care coach standing behind you down the stairs one step behind throughout the process to help make sure you are safe. Coming down the stairs, you're going to be leading with your surgical leg. I know this may sound counterintuitive, but it is the safest way to do it, and it puts most of the work on your non-surgical leg. So, lead with your surgical leg down, and bring your non-surgical leg to meet it, following it down the stairs. Your care coach, when assisting you, should stay one step below you throughout the entire process.